Thank you all. I'm really excited to be here today, and of course, thank you, Lori, for inviting me. I think it's incredible that this department supports the sustainability or climate change-related grand rounds every year, so I really applaud the support this department for allowing this. And so, yes, this is a picture from our ENT Academy this year, and this is basically your ENT Sustainability Task Force. So you all know Duncan, and then Amanda Dilger is with Mass Ioneer. I have no relevant disclosures. So 3 main objectives I want to talk about today. The first is the effects of climate change on health, and I'm going to focus specifically on health equity. And then I'm going to talk about opportunities for us to engage in sustainability initiatives as surgeons, and then also some other strategies that we can do outside the operating room for addressing climate change, which includes education of patients and engaging in activism efforts. So why are we talking about this? Well, there's 2 main reasons. The first is the outsized carbon footprint of the United States. So the top 3 greenhouse gas emitters are China, the EU, and the United States. And the U.S., right here, is number 2. The bottom 100 countries, which oftentimes are going to be suffering the worst impacts of climate change, account for only 3.6% of the global carbon footprint. So that's reason number 1. Reason number 2 is the U.S. also has an outsized carbon footprint from the healthcare sector specifically. So globally, the healthcare sector accounts for about 4 to 5% of carbon emissions. The U.S. is the leading emitter of carbon emissions from the healthcare sector, with about 27% of emissions of that 4 to 5%. So this graph on the left here is from The Lancet. And what it shows is greenhouse gas emissions from the healthcare sector, and then on the y-axis, healthcare access and quality index. And what you can see, U.S. is over there, the outlier in red, is as the emissions increased, the quality and access did not necessarily proportionately increase as well. So what this study found was that where the x and the y-axis crossed was at about 400 kilograms of CO2 equivalents per person, right? And so the U.S. is really outsized at over 1,700 kilograms of CO2 equivalents per patient, but yet our healthcare access and quality does not proportionally increase to match this outsized carbon footprint. So what this tells us is that we can have the same quality of care with a much lower carbon footprint. So what does climate change mean for health? This is another image from The Lancet Countdown on Climate and Health. And it's a little bit messy, but what it really does show is how complex of a topic this is when we're talking about climate change and health. And so there's so many different things that we're considering. Let's see if so there's so many things that we're considering when we think about the health impacts of climate change. And so some of the major environmental changes that we're seeing with climate change, such as floods, heat waves, drought, and fire, all of that impacts undernutrition, mental health, cardiovascular disease, respiratory disease, allergies, vector-borne diseases. But then what you also see over in green is how this is also a social determinant in health and how this is impacting poverty and mass migration and increasing conflict when there's less land for people to live on due to things like drought and flooding. So this is a really complex issue, but it's really one of those that it's the reason that so many medical journals have called climate change the leading public health problem of the 21st century. So I included this because a lot of times when we think about all the numbers related to climate change, it's hard for us to understand why does 1.1 degrees Celsius or 2.2 degrees Fahrenheit matter. So this graph on the right here is basically showing that all of the major, so NASA, NOAA, Berkeley, like all of the major institutions that measure temperature increases agree that there's been about a 1.1 degrees Celsius increase in global temperatures. And this graph on the left, on your right here, from the Intergovernmental Panel on Climate Change shows how this 1.1 degrees Celsius increase in global temperatures matter. And so what we're really seeing with global warming is that the number of extreme heat events is going to increase, right? And so basically with no warming, a heat extreme event that would have happened once every 10 years with 1.5 degrees Celsius of warming is going to happen 4 times more likely. With 2 degrees Celsius of warming is going to happen 5.6 times more likely. And the same thing we're seeing with a heat extreme event that would have normally happened once every 50 years without global warming would have happened once. With 1.5 degrees Celsius is 8.6 times more likely, and with 4 degrees Celsius of warming is 40 times more likely. And that's what we're seeing in the environment that we're living in. We're seeing extreme weather events happening more frequently, which is exactly what this graph from the Intergovernmental Panel on Climate Change shows us, and the weather events themselves are more extreme. So because we're ENTs, I just wanted to include one slide on how climate change is impacting our patient population here. So temperature is the strongest predictor of atmospheric pollen concentrations, and global warming has been linked to an increased growing season of pollen, right? So if you have warmer temperatures, you have trees and plants that are able to bloom earlier in the year and then last longer into the fall. You have pollen growing in new geographic regions. So as we have changes in temperature and precipitation patterns, you have trees and plants growing in new regions. And you have an increased concentration of pollen in the environment. So when there's increased CO2, you have increased photosynthesis, plants and trees are growing more and producing more pollen. And so what this study showed is that over the past 30 years, they looked at 60 different pollen stations in the United States, that the average pollen season is about 3 weeks longer than it was 30 years ago, and there's about 20% more pollen in the air than there was 30 years ago. So about 2 or 3 years ago, I was out for coffee, and this is in December. I was at George Washington, so I was in Washington, D.C., and there was this mosquito flying around me. And it was an unseasonably warm December, but honestly, we keep seeing these unseasonably warm years, right? It's like every year seems to be breaking heat extreme records. And I remember thinking, like, I cannot believe there's a mosquito, like, flying around me in December. And I was talking to one of my friends, a pediatrician, Sam Madut, and she was saying, Nilu, she was like, I saw 2 cases of Lyme disease in my patients in December. Like, these are things that we were not seeing 30, 40 years ago. And so one of the other things that we're going to be seeing a lot, especially in the news, is how global warming is impacting the spread of mosquito-borne diseases, different vector-borne diseases, how it's impacting West Nile virus, malaria, dengue. And so I wanted to include this slide just because I think this is one of the topics that especially media is going to be covering a lot, and it's one of the really important ones, both here in the United States and globally. So I'm going to shift gears a little bit and talk about environmental justice. I really don't think any conversation about climate change can be complete without talking about environmental equity. And environmental justice is an integral component of achieving equitable planetary health. This was a graphic that was put together by, so Climate Code Blue is an organization in Boston that really works on climate change and sustainability initiatives, and then Greater Boston PSR. And so the whole idea here is with the increase in oil and gas, fossil fuel combustion, that's impacting asthma rates. So what is environmental justice? It is the principle that all people and communities have a right to equal protection and equal enforcement of environmental laws and regulations. Dr. Robert Bullard, who's considered one of the fathers of environmental justice, says that zip code is still the most potent predictor of an individual's health and well-being. So the idea here is that the environment that we live in is one of the most impactful things to our health. And there's a couple of different reasons for historic environmental racism. And so what this little clip is going to show, hopefully it works, is a description of a pipeline that was being built in Memphis, Tennessee, and how they chose the community that this pipeline was going to be built through.
History is only part of the story here, because it also is about who has the power to push back. And polluters often assume that black communities in particular won't be able to stop. Take the Byhalia pipeline. It was a joint venture between these two companies who planned for their oil pipeline to take a very deliberate path through Memphis.
The path Byhalia proposed winds down through South Memphis, cutting through several historically black communities. There is a more direct option, but that would cut through predominantly white, wealthier neighborhoods in the north.
Now that does seem a little odd, doesn't it? Normally, the shortest distance between 2 points is a straight line, not through any black people who happen to be living nearby. Although, of course, the least surprising thing there is that the white, wealthy suburb is called Germantown. That is the name you give your community when Aryanville feels a little too obvious. And while the companies behind the Byhalia pipeline insist they had good reasons for choosing the path that they did, according to a local activist, a rep for them once accidentally said the quiet part out loud.
There was a community meeting that Byhalia Pipeline held, and they were asked by one of the members of the community, why did you all choose this route? And there's usually a PR answer. But instead, the representative was pretty clear and plain. What he said, we basically chose a point of least resistance.
Sorry. Right, and so when you're thinking about Black and brown communities, when you're thinking about communities who are of a lower socioeconomic status, they tend to not have the resources to be able to push back against things like polluting facilities and pipelines. And so that is one of the reasons that a lot of these communities, to this day, have higher levels of pollution and are dealing with the heat island effect and a lot of the environmental risks that these communities are subject to. Redlining is another reason. And so there's been a lot of increased coverage of redlining over the past couple of years. But what redlining is it's a historically racist housing practice in the 20s and 30s where communities that were predominantly Black were outlined in red as risky areas of investment. So the New York Times did a big expose on this, and the city that they used as an example was Richmond, Virginia. And basically, the communities there that were predominantly Black, they found had been redlined, again, as risky areas of investment. To this day, those communities have more paved surfaces, like roads, and we'll be talking about the problem of highways and roads in a moment, and parking lots, which tend to really absorb and increase the heat of the surrounding community. They have less green space, and so green space is really great for cooling down the community that you live in, but it's also really important for mental health, to be able to walk in the park, to have your kids play in the park. And to this day, these are some of the hottest areas of town. So studies show, on average, these areas during the daytime are 1 to 7 degrees Fahrenheit hotter than surrounding communities and 2 to 5 degrees Fahrenheit hotter at night than surrounding communities. So Richmond, Virginia is just one example. But the same situation is being seen in cities across the United States. And so this was a study that looked at 175 different urbanized areas in the U.S., and what they found is that the average person of color lives in a census tract with higher summer daytime temperatures compared to non-Hispanic whites in all but 6 of the 175 areas that were studied. And this similar pattern was also seen for people who lived in households below the poverty line relative to those who are more than 2 times the poverty line. So the modern U.S. highway system is another reason that certain communities are subject to certain environmental risks that other communities are not. So the U.S. highway system was built in the 50s and 60s, and planners of the highway system would oftentimes route highways either through a prominent Black and brown community to disrupt it, or immediately adjacent to it to segregate it from the surrounding communities. No white men's roads through Black men's homes was a rallying cry for U Street in Washington, D.C., which is a really prosperous Black community. It's actually one of the few successful efforts that the community had to not have a major highway built through it. So why are highways such a concern for environmental health? So one is what we just saw in Richmond, Virginia, more paved surfaces like roads and parking lots that tend to absorb and increase the amount of heat. The other major issue is the increase in air pollution. So from tailpipe emissions, there's a ton of different air pollutants that come out and that impact respiratory health, cardiovascular health, increase the risk of stroke, increase the risk of dementia. One of the main air pollutants that's been studied is fine particulate matter, specifically PM 2.5. And you all might have heard this a lot just because PM 2.5 is being studied a lot in wildfire smoke, which is a huge issue here on the West Coast and its impact on, again, respiratory health, cardiovascular health, and even pregnancy complications. So a standard human hair is about 50 to 70 microns in size. Fine particulate matter are less than 2.5 microns in size, and there's even ultrafine particulate matter, which are less than 0.1 microns in size, and those are the particles that are actually able to enter the bloodstream and increase the risk of cardiovascular disease and increase the risk of stroke. So this is a study that basically looked at a bunch of different sources of fine particulate matter from all of these different sources. So they looked at industrial, coal, heavy and light duty vehicles, construction, road dust, agriculture, and what they found, and they basically separated from white Americans, people of color, and that was further separated into Black, Hispanic, and Asian. And what they found is that people of color in general were disproportionately exposed to fine particulate matter from all of these different sources of fine particulate matter, but that Black Americans were disproportionately exposed in every single category. And so this held true across different states, urban and rural areas, and income levels. And so basically, we're not all breathing the same air, right? We definitely know that some of our patients, some of our communities are breathing in dirtier air that is impacting their health negatively. And so one of the significant concerns for this is, how is this impacting children? How is this impacting the next generation? So this was a study, or a systematic review that was done in JAMA a few years ago. Bruce Bakar and Nate DeNicola are both OBGYNs who talk a lot about environmental risks to pregnancy. And what they showed was that increased exposure to fine particulate matter, PM2.5, was associated with an increased risk of preterm birth in 79% of the studies and low birth weight infants in 86% of the studies. So again, this brings us to the point of how are we impacting this next generation, right? We know that premature birth and low birth weight can set the stage for a lifetime of consequences. And so what are all of these children who are born into these communities having to deal with just because of their zip code? So I'm going to do one more ENT angle here. And this is looking at fine particulate matter and chronic rhinosinusitis. And so, and again, this is just sort of, I want to include these just sort of as a reminder of how relevant these topics are to our patients. And what this study showed was that the increasing amount of time that people were exposed to fine particulate matter increased their risk of chronic rhinosinusitis in non-allergic patients. And what they found was that the longer that you were exposed, that increased your risk of chronic rhinosinusitis even longer, with a peak at about 36 months of exposure, with ethmoid and maxillary sinusitis being the most common areas for disease. So I'm going to focus the rest of the talk on objectives 2 and 3, which is really what can we do, right? We've talked about the scope of the problem. We know this is a huge issue to our health, to health equity. So what is our role in all of this? So Saturday night, I became a fellow of the American College of Surgeons. Was anyone at the fellow? And so basically one part of this ceremony is we say a pledge. And this is one line from the pledge. I further pledge to affirm and support the social contract of the surgical profession with my community and society. So what I take from this is that part of our role as surgeons is to act in the best interest of society. So this is part of why I do this work. I wrote this piece with Eva Ferguson, Bryan, and Liz Yates a couple of years ago in the AMA Journal of Ethics. And what we were really trying to describe here is that it is part of our ethical obligation as surgeons to be considering the emissions from the healthcare sector, to be talking about climate change. And so I included part of the abstract because the health sector has obligations and ample opportunities to protect health by decreasing waste and motivating more system-wide sustainable clinical practices. Such efforts will have important ethical implications for health equity. So really, we have a very prominent role to play in this space, and we have ample opportunity to do so. So the question is always where to begin. So here's a couple of different options. One is you can always start with your personal choices, right? We can eat a more green-based diet. We can choose vehicles that do not rely on fossil fuels. So this basically is a study that showed individual actions that are low impact, moderate, or high. One of the highest impact things is having one fewer child. I'm not someone who's gets really caught up in climate guilt. I'm not going to tell anyone to have fewer children. I think that personal choices and the things that we do as individuals are important, but this is a much larger issue. And so I think, again, some people find value in these things, but it's just one opportunity for taking climate action if it appeals to you. You can attend rallies, protests, and civic action. Again, this is not everyone's cup of tea. Right now, there is a lot of momentum for really engaging in civic action just because so much of climate legislation depends on it. And a lot of people find a lot of value in community support and, being in rallies and protests. This was actually from Climate Week last year in New York. They had a really big march, and there was a huge health sector that all of us were marching through. But again, this is just one way to get involved. And then, of course, we can always think about our own carbon footprint in medicine and how we're able to address that. So how did I start? Well, when I was in residency and I was starting my 4th and 5th years, I finally had time to think about something besides being on call and patient care and how I was going to survive. And so I started to really, and the 2016 election also played a huge role in this, is to really think about what did I want to do about climate change. It had always been something I cared about in the environment. I think was always something that a lot of us care about, but I realized I needed to do something more than that. So I started out by doing a couple of different, had a couple of different opportunities to really train myself. So the first is the Climate Reality Project. So this is the organization that was started by former Vice President Al Gore. And basically it's a 3-day immersive into climate change 101, right? Like, what is it? What are all the concerns related to it? The program itself is free. You just have to, if it's not in your hometown, you have to pay for housing and transportation there. But it's a really good, basic overview of climate change. But for me, starting out, it provided me some of the details that I need to know about how climate change impacts health. The second is I'm not a climate scientist, and so what I really needed to do was understand climate change on a greater scale. And so there's a lot of different online courses or in-person opportunities for learning about climate change. I did, this one specifically is a course that was offered by Dr. Michael Mann, who's a climate scientist, and it was really just about self-education for me to understand, again, the science behind it. And then I did the Public Voices Fellowship on the Climate Crisis, and so this was a joint collaboration with the Yale Program on Climate Change Communication and the Op-Ed Project. And so a big component of this is a year-long fellowship, was let's learn about climate change, let's talk about climate change communication, and how are we going to effectively talk about it. And so these were just giving me some of the fundamentals for, one, understanding the scope of the issue, but then also how to talk about it. And honestly, pretty soon after that, I was at rallies, and this is actually with the Sierra Club, and I was sort of the health spokesperson for talking about 100% clean energy for Arlington, Virginia. And so sometimes it's just sort of diving in about things that we care about and saying, okay, this is something that I'm concerned about from a health perspective. Let me share this information with the wider community. So these are some options, but what I think is going to resonate with most people is the climate action Venn diagram. So this was made by Dr. Ayanna Johnson, who's a marine biologist, a very prominent climate activist. And basically, with this Venn diagram, she describes your climate action as being at the intersection of what brings you joy, what are you good at, what are your skills and resources, and what work needs to be done. And I would say that all of us in this room have 3 main areas that really intersect to involve all 3 of these: research, advocacy, and education. So research. There's a lot of different opportunities here to get involved with climate change research, with sustainability research. So some of the main focus areas that have been talked about is air pollution, air quality. Again, there's been a lot of data coming out recently about fine particulate matter, especially as it's coming from other sources besides tailpipe emissions, as I mentioned earlier, from wildfire smoke as well. Environmental inequities, so how are certain communities being impacted. Occupational health, so when we think about the outdoor workers, right, it's hard now to eat strawberries and blueberries without thinking about who picked these outside. In the summer of 2024 was the hottest summer on record. So who are all the outdoor workers who are who are out there picking this fruit. And right now, at least, there's no federal legislation protecting these outdoor workers from heat extremes. Extreme weather events, right? So we're seeing this with hurricanes, with flooding, with wildfires. And then, of course, sustainability in medicine is a huge area. This is one of my favorite studies. This was done at UAB, and basically it looked at slimming down cardiothoracic surgical trays. And what they reported on is the cost savings of standardization of these thoracic surgical instruments, and they called this the process of lean. But what I really like to study is because they were doing this from an economic standpoint, but they also talk about all of the energy and water savings that they had by having less instruments that were being processed for each case. And they make a point in the study to say that no instruments that had been eliminated were asked for during the year of this study. And they reported about over $69,000 in savings from having less instruments that are being processed and shorter OR times because the circulator did not have to look through as many instruments to find the ones that were necessary. So this is a project that, again, it's not like slimming down trays or standardizing trays is not a small project, but it's definitely one that all of us can partake in. And what's really nice about some of these studies is that we're really able to see the avenue for clinical change from the data that's coming out. So this is a study, this is a life cycle assessment that was looking at hysterectomies, and this particular graph itself is showing how certain anesthetic gases have a higher carbon footprint than other anesthetic gases. And so basically, up at the top is, in the red circles, is desflurane, and then in the upside down triangles is desflurane and nitrous oxide, and then SIVO is below in blue. And so in most clinical cases, desflurane and sevoflurane are clinically comparable for most patients. It's just that desflurane has a much higher carbon footprint than sevoflurane, and it's actually more expensive as well. And so what we're able to do is take this information and use it as an avenue for change. And so at GW, education on the carbon footprint of desflurane use led to a reduction in desflurane use, right? So it's really just talking about the problem and saying we have the data to show that it has a much higher carbon footprint, it's more expensive. Again, in clinically equal situations, let's transition to SIVO over DES, and that's one quite impactful way to really decrease the carbon footprint that's coming from the operating room. And so I think that's where research can be incredibly valuable, is because we're really able to see these changes in real time. So next we're going to focus on advocacy, which is one of my favorite areas. And what's really nice is that there's actually a ton of organizations that are really working with the healthcare sector on different advocacy goals and initiatives, and this is just a couple of them: the American Public Health Association, the Global Climate and Health Alliance, Healthcare Without Harm, the Medical Society Consortium on Climate and Health, and PSR. And so for anyone who wants to sign up for a listserv, I'd probably say the Medical Society Consortium on Climate and Health is probably the best one. They don't put out a ton of emails, maybe one or two a month, but basically gives you an overview of what's happening in the climate and health space. There's a couple of different ways to approach advocacy. So one is civic engagement, right? Climate policy is health policy. We have to take the politics out of climate change and really talk about it as a health issue. So as healthcare professionals, we have the opportunity to advocate for climate legislation. We have the opportunity to educate policymakers on why specific climate legislation is so important for public health. So this picture here is Virginia Clinicians for Climate Action. So it's a group of us, it's a whole bunch of doctors and medical students and pharmacy students and nurses who went down to Richmond, Virginia to meet with Virginia state legislators when they were in session to talk about, we had 6 different pieces of Virginia legislation, or Virginia state legislation that was being considered. And for each of those 6, we talked about how this improves public health. Because that also gives your policymaker, your elected representative, talking points when they're talking to their community to say, if I support this legislation, this will improve the health of this community. And on the left there is a couple of physicians and representatives when we were talking in front of the Capitol about climate and health advocacy and really, why, again, climate legislation is so important for the healthcare sector. So again, this may not be everyone's cup of tea. I spent 6 years in DC. I got really comfortable with civic action and civic engagement, but it's not for everyone. but I do think it has a lot of value, especially right now with climate change being such a prominent issue and concern, and the fact that there is a certain amount of time that we have to make really substantial strides in climate action to decrease the public health concerns in the future. Another way to advocate is through our professional societies. And so the two that I have been most involved with is American College of Surgeons. So when I first started doing this, I remember emailing one of the advocacy individuals with ACS and just being like, this is a huge concern. I really think ACS should advocate on it. And I always got emails back, but they were always like, this isn't something that's on our radar. We don't have the bandwidth for this. We're not interested. Like, no. But I just kept emailing every 3 to 4 months and just saying, this is something that's an issue. And like 2 years ago, I get an email that's like, ACS is kind of interested in this topic now. Let's talk about it. And so I say this because we have, like, when we keep using our voice, when we keep pushing for initiatives, this is how change can happen. And so in July, we presented at the ACS Quality and Safety Conference about a couple of different QI initiatives. And we're going to be talking about it a little bit this afternoon as well. So this is not in place yet. This is something that a couple of us are working on to implement with ACS as QI initiatives. But the three things that we're recommending is that ACS support reduction in desflurane use, streamlining surgical trace, and improving single-use device reprocessing as three initial initiatives for hospitals to partake in as a quality improvement initiatives, but of course also as sustainability initiatives. And then our ENT Academy. So this, again, was a very slow roll forward, but finally, last year, we got approved to have this environmental task force, and this is part of why, the four of us were able to meet and talk about sustainability and ENT, and we're really trying to meet with all of the different subgroups of the Academy to consider ways to incorporate sustainability into those. Using your voice is clearly very important to me. And here are two different ways that you can do that. So the first is through testimonies, right? And so when there is legislation or proposals being considered, we can use our health voice to say this is why this is important for public health. You may not know about some of the things that are being considered, but that's why it's helpful to sign up for some of these listservs. This is basically an email that I got from PSR that's saying we want the Environmental Protection Agency to set higher standards for particulate matter. And so basically it was you just go online, you fill in a little form and say why this is a health concern, why you support this legislation to have stricter standards for fine particulate matter, which is basically we want cleaner air, which I think we can all support. So that's one way that we're really able to use our voice. And the second is with op-ed writing, letters to the editor. This is a piece in the Washington Post that was written by Samantha Adut, the pediatrician I was referring to earlier, and Karen Camplin, who's an EJ organizer. And basically, the Mountain Valley Pipeline was trying to put a compressor station through one of the communities in Northern Virginia. And basically, in this op-ed, they wrote why this compressor station would negatively impact the health of the kids in the community that lived in that area. And so, again, it's using our health voice to advocate for things that we know are not going to be helpful to the health of our patients. Talking about climate change can sometimes feel a little bit daunting. The Yale program on climate change communication is a really great resource for just understanding where people are on climate change and how to talk about it. They have some guidelines there. But what this graph specifically shows is from 2013 to 2023, the number of people who are alarmed about climate change has increased by 13%, and the number of people who are concerned has increased by 5%. This might be because the people who were cautious, which has decreased by 11%, are now more concerned or alarmed, and then disengaged, doubtful, and dismissive has remained relatively stable over the past 10 years. And so what this is showing us is that more people are alarmed and concerned. And one of the misconceptions about climate change is that I'm the only person who cares about it, which isn't true, right? There's a lot of people who care about it, and the more that we talk about it, the more that we're able to raise awareness. And so when talking about it, what the data also shows is that the people who are alarmed and concerned, one, have the highest belief in global warming. They're also going to be the most motivated to take climate action. So again, one of the misconceptions around climate change is, well, how do we get the doubtful, dismissive to believe in climate change. But we actually don't necessarily need them to believe in climate change. What we need is all of the people who are alarmed, concerned, potentially even cautious to really act on climate change, to be motivated to contact their legislators, to really push for a fossil-free future. And so that's actually the top part of the graph is where we really want to focus our efforts, and not really trying to talk to your uncle about who doesn't believe in climate change about why it's important to you. And actually, I did have a car ride with one of my uncles. By the end of it, he did agree that air pollution is an issue, but did not really believe in climate change still. So again, what we really want to focus on is the people who are alarmed and concerned, because they're the ones that are going to be the most motivated to take action. Dr. Ed Maybach, who leads the George Mason Center for Climate Change Communication, has basically 5 bullet points that he recommends when talking about climate change. So the first is to say that experts agree human-caused climate change is happening, and there is consensus among scientists. It's real. It's us. It's bad, but it's solvable. And so really what this is showing is it's establishing the expertise and really talking about the scope of the problem, but then also ending with an element of positivity and hope by saying it's solvable. And finally, we think about our Venn diagram. I'm going to talk a little bit about education. So really when we think about education, we're thinking about who are your spheres of influence that you're really able to educate and talk about climate change with. So the first is talking to each other as colleagues, right? So there's so many people in the healthcare space who don't understand how much healthcare contributes to climate change. And so we know that the U.S. has an outsized carbon footprint. During this talk, I didn't really talk about sustainability specifically, but this graph just shows all of the different ways that healthcare contributes to climate change. And so there's a lot of different sources of carbon emissions. Some are necessary for patient care, but again, as we learned with the desflurane, sevoflurane example, or with the slimming down surgical trays example, there are actually a lot of different ways that we can decrease our carbon footprint and still achieve optimal patient outcomes. We could talk to our healthcare leadership. One of the things I learned probably the hard way is that you really have to have healthcare leadership on board to make an impact. And one of the avenues for having these discussions can be the cost savings and sustainability. The Cleveland Clinic has been a major leader in sustainability, and they're really open about publishing some of their cost savings with different sustainability initiatives that they've done. And so that is one way to start the conversation with leadership. But really what we know from the healthcare sector is we need systemic change, and so many sustainability initiatives require multiple different departments coming together to work on these different initiatives. And so one example is at GWI is trying to decrease the number of air exchanges in the operating rooms when they're not in use, because normally the air is exchanged 24 hours a day, but you don't technically need that if the operating rooms aren't in use. That's a huge energy savings. But it required the head of the operating room, it required the ID committee to be involved, and it involved engineering to be involved, and then I needed the support of the healthcare leadership. So there's a lot of different players for every sustainability initiative, but if you have leadership on board, then they're able to get everyone together to do this. Educating students. So medical students across the United States are honestly leading the movement for change. There's an organization called Medical Students for a Sustainable Future that's really pushing for the integration of climate change and air pollution into medical school curriculums, and this is something that we're seeing slowly pop up across the U.S. in different medical schools. But this is also, the whole idea here is you're educating a new generation of healthcare professionals on what to expect in their patients and how to counsel their patients more effectively. And then, of course, talking to our patients and talking to community members about climate change as a health risk. Again, this is one way to depoliticize climate change, is to really focus on how it is a health concern and all the different ways that it's impacting their health on a day-to-day basis and the health of their loved ones. So my current roadmap is a little bit of a, let's try a little bit of everything and see what works or doesn't work. So at GW, I was fortunate enough to co-direct the Climate and Health Institute with Dr. Susan Annenberg, who's at the School of Public Health. And so the two of us did a lot with research, education, advocacy. And then now, starting at NYU, I'm going to be working with their hospital sustainability team on sustainability initiatives. Community engagement, I think, is hugely important. There is a group in California called Climate Health Now, if anyone wants to get involved with them. They do a lot of California-based legislation. So this is a picture, the same picture when I was at GW from Virginia Clinicians for Climate Action. And then, of course, our academy. Engaging with policymakers, submitting public statements. And some of the best advice I got early on, and I think anyone who's done any sort of advocacy efforts will agree to this, is that there's no right way to be an advocate, right? This is something when it's something you really care about, it's sort of an all hands on deck approach. And so I've done a lot of, as Larry was saying, a lot of writing, a lot of speaking, and really sort of wanting to talk to the community directly about why climate change and air pollution are such significant health concerns. And so that's been my focus. And again, these are not things that I thought I would be doing as a medical student or as a resident, but it's been a natural progression, just considering that climate change is such a here and now issue. So I want to end with a small anecdote on our capacity as individuals. So I think, again, one of the negative things about climate action is, what can I do as an individual? And so this is actually a story that was also shared at the fellow convocation on Saturday. But basically, the Children's Eternal Rainforest in Costa Rica is the largest private reserve. So basically, in 1986, a teacher there was talking about the rainforests in Costa Rica and about deforestation. And the kids were concerned. And so the next year, she invited a biologist to come, and this is in Sweden, to talk to the kids about it. Well, with that conversation, the kids were so motivated that they had bake sales and raised enough money to be able to buy 6 hectares of rainforest in Costa Rica. And now, 37 years later, there's 22,000 hectares that are currently protected, and it all started from those 6 hectares that were originally protected from these kids who were having bake sales. And this is now Costa Rica's largest private reserve. And so there is a huge capacity for what we do as individuals to grow with getting more and more people involved, and with the power of time and moving forward. So I really appreciate all of you listening today. And I always like to try to end with a little bit of a take-home. I know I gave a lot of different potential opportunities for action, but the 3-person challenge is to try over the next week to talk to 3 different people about climate change or sustainability solutions, or why this is something that should be on the ballot, and why we need to be environmental voters, any of those topics. And so talking to a patient, a family member, a friend, or a colleague about supporting a greener, more equitable future. And a couple of years ago, I started a listserv called Surgeons for a Sustainable Future, which is really casual. I don't send out a ton of emails, but basically about 3 to 4 times a year, we'll have like a speaker talk about something related to surgery and sustainability. So if anyone is interested in just joining that listserv, feel free to send me an email, and I can add you to that moving forward. So, thank you. If there's any questions, please let me know.
Thanks so much, Neelu. That was really, really awesome. And I hope that resonated with many of you. I'm so thrilled she was able to be here with us. And what questions can we put to Neelu about how to get started with this work, or anything?
Hi, I'm Zara Patel. I'm one of the rhinologists here. Thanks so much for that talk. It was wonderful. I think that it was really interesting to see that graph of people who were alarmed and cautious and dismissive. And I wonder if that has been looked at on as far as political landscape, like where people fall in that. And that's kind of the question I have for you, is that I think that we're kind of lucky to be in this California bubble, at least in a sort of California urban bubble, where most people you talk to do believe in climate change, think it's a problem, and want to do something about it. But when you look at our country overall, that's very split. And how, from your time in Washington, have you found techniques at which you can actually remove politics from either climate change or any public issue, like health issue, like gun control, anything else that we want to talk about from a scientific sort of authoritative healthcare perspective without, getting into the political landscape where, unfortunately, you can find a scientist or doctor to say that that's not real, it's not caused by humans, and that's a bunch of, how have you found a way to try to remove politics from that conversation?
Yeah, I think the most straightforward way is, again, going back to the health impacts. And so, DC is its own bubble. I did also see patients in Virginia, which is slightly more purple. But so a classic example is, I don't know how often you have patients that will say something like, God, I feel like my allergy symptoms are getting worse, or I feel like they're starting earlier. That is a prime opportunity to say, yeah, we're actually seeing this in the data. There's a couple of different reasons for this, and one of them is global warming, or is climate change, or is that the environment's changing, right? So it's choosing your phrasing depending on the patient. But I use those type of examples a lot, where it's, if someone says something to me where I'm like, oh, this is like an opportunity for me to talk about climate change in a way that then I'm hopeful that that patient will then be able to take that information back to their family, their friends, their community. And so it's really just spreading awareness. I think allergic rhinitis is a really straightforward way of doing that. When the wildfire smoke was really bad last summer, that was also like a really straightforward way of saying, like the wildfire season is getting worse. And we had a ton of the smoke on the East Coast as well. And so I had a bunch of patients who were canceling clinic. And then when they were coming in to see me, we would talk about air quality and the worsening wildfire season and things like that. So I think talking specifically about the health impacts without even like considering the political lens, but saying this is what the data is showing in a way that it takes a little bit of time, but like eventually it starts to come out a little bit more naturally. Heat extremes is another one. I have a lot of my patients would take the bus or walk to the clinic. And so, especially in DC, they were just like standing out at the bus station in the heat extremes. And so they would come, they would be like, famished, and we would talk about how the summer was getting so hot and how global warming is contributing to that. And again, I think using the words global warming or climate change or changing environment, poor air quality, it all depends on like the patient you're talking to, the words that we choose to use. From a what can we do beyond the bubble that we live in, I do think that's actually why these state-based organizations are really great. California is also like leading on a lot of climate legislation, but it is an opportunity for us to really support legislation on a state level, which is hugely important. I'm going to be canvassing in Pennsylvania next weekend, and so that's just adjacent to me, so I have that opportunity to do that. And so I think sometimes it's just like going beyond the state that you're in if there's not opportunities there. There is the Environmental Voter Project, I'm a huge fan of. They're basically a nonpartisan organization that's all about mobilizing environmental voters. And so they have a lot of phone banking opportunities as well, even if you're not able to do door-to-door knocking. So I think those are like some ways to use our voice. That one's not necessarily the health voice, that's just mobilizing environmental voters. But I would say the biggest thing is with patients themselves is if you talk about it a little bit with them, then they're like, oh my God, Dr. Patel really cares about this. Like, I'm going to share this with my friends and my community, and then hopefully that's what continues the conversation forward.
There has been some research actually about climate communication, and it is possible to move people that you would call red. Again, being careful with the language you use, but tying it to people's health and to people's family is very motivating compared to, oh, there's this theoretical problem out there. But how it is affecting you or your kid or your grandchild, that is a way to depoliticize it. And again, I think sometimes choosing the words, maybe climate change or fossil fuel, or just be careful about it. But bringing it from out here to me and my family and my health, we all care about ourselves and our own health and our family's health.
field program on climate change communication does have data where they look at like liberal Democrats, moderate Republicans, conservative Republicans, and their beliefs as well. They've got like some pretty good data that looks at all the different populations and how their views on climate change specifically are evolving. So, yeah.
Other questions? All right.
Well, thank you all so much. I really appreciate your time.